Nipple aversion in breastfeeding babies occurs when a baby resists or refuses to breastfeed, often leading to stress for both the mother and the infant. There are several potential causes, and understanding these can help in addressing the issue. Causes of nipple aversion. 1. Overstimulation or forceful letdown. Some babies may experience an aversion if the milk flow is too fast. This can make breastfeeding uncomfortable and lead to avoidance. 2. Pain or discomfort. Teething, ear infections, or oral issues like a sore throat or thrush can cause discomfort while nursing, leading to nipple aversion. 3. Negative association. If a baby associates breastfeeding with an unpleasant experience, e.g., a loud noise, being pulled away from the breast suddenly, they may develop an aversion. 3. Change in routine or environment. Moving to a new environment, changes in the mother's centaur. The introduction of a bottle can cause confusion or preference for different feeding methods. 4. Maternal stress or anxiety. Babies can pick up on a mother's stress or anxiety, which may create a tense environment during nursing. 5. Delayed feedings or overfeeding. Skipping feedings or trying to feed a baby who isn't hungry can lead to frustration and refusal to nurse. 6. Sensory sensitivity. Some babies have heightened sensory awareness and may be sensitive to the feel of the breast or nipple temperature changes, or even certain fabrics or textures touching their skin while breastfeeding. 7. Changes in breast milk. Taste. Factors like maternal diet, medications, or hormonal changes, e.g. during menstruation or a new pregnancy, can alter the taste of breast milk, leading to temporary aversion. 8. Tongue tie or lip tie. These oral conditions can make it difficult for a baby to latch correctly, causing frustration during nursing sessions. If left untreated, they can contribute to nipple aversion. 9. Weaning attempts or mixed feeding. Introducing bottle feeding, pacifiers, or solid foods too early can lead to nipple confusion, where the baby prefers the ease of feeding from a bottle over the breast. 10. Reflux or gastroesophageal reflux disease. Babies with reflux may associate feeding with discomfort, causing them to avoid the breast. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and hit the notification bell so you don't miss any of our future videos.